EN 4.9 demonstrate the correct technique for syringing wax from the ear in a simulated environment, presented by ENT student. This is a core competency which comes under the domain of skill, and the level shows how, and the suggested teaching or learning method is a dope session. What is ear syringing? Ear syringing is also called as ear irrigation, which is a routine, painless procedure to remove excess earwax or foreign objects from the ear. The patient's ear canal is flooded with sterile water or saline solution. This is usually done to cleanse the ear canal of any discharge, soften and remove impacted earwax, or extricate a foreign body from a patient's ear. Now, what are the equipment that we need for this procedure? First is a face shield, which comes under universal precautions. Next, to safely perform ear irrigation, one should also use an otoscope. You will also need a ceruminolithic of choice. The water you will use for irrigation must be warmed before use. You can either use a 30 millimeter to a 60 millimeter syringe with a 16 or 18 gauge intravenous catheter attached with the needle removed, or a pulsating water device to irrigate the impacted cerumen out of the ear. You will also need an irrigation basin or MSS basin to catch the water and pieces of cerumen as it leaves the ear. Due to the availability of syringes and IV catheters when compared to pulsating water devices, the syringe and IV catheter method is more common. A cerumen spoon or alligator forceps can be used to remove loose cerumen pieces following the ear irrigation procedure. What are the indications for syringing? First is the removal of wax, dried fungal debris, epithelial debris, and blunt foreign bodies. And the contraindications for syringing are acute inflammatory conditions of the external and the middle ear, discharge from the ear, perforation of the tympanic membrane, any previous ear surgeries, impacted hygroscopic foreign bodies or sharp foreign bodies in the ear. In these conditions, syringing is contraindicated. Coming to the procedure, first we have to ask the patient to sit upright. Place your ceruminolithic of choice in the external auditory canal and leave it in the ear for 15 to 30 minutes before initiating the irrigation process. Draw up the warm water into the syringe and attach the IV catheter to the end of the syringe. Place the IV catheter into the external ear no further than the cartilage or bone junction. The cartilaginous portion usually makes up the lateral one-third of the external auditory canal. Hold the emesis or ear irrigation basin tightly to the skin below the ear in an attempt to catch the water during the irrigation. This will help the patient from getting wet. Direct the IV catheter superiorly and posteriorly in the ear canal so that the water will separate the cerumen from the tympanic membrane. Do not direct the water stream directly at the tympanic membrane because this can cause perforation. Do not inject too rapidly as this may result in trauma, bleeding, and pain. Following irrigation, you can remove any loose pieces of wax with a cerumen scoop or alligator forceps, being careful not to damage the external auditory canal and the tympanic membrane. To dry the remaining moisture in the external auditory canal, apply several drops of isopropanol. This step is especially contraindicated if the tympanic membrane is ruptured. The complications that can happen because of this procedure: irrigation of the ear can lead to otitis externa, vertigo, perforation of the tympanic membrane, and middle ear damage if the tympanic membrane is perforated. These complications are less common with the syringe and IV catheter technique than when compared to the pulsating water device technique. Using a cerumen spoon to remove the remaining wax can cause damage to the skin covering the external auditory canal. Symptoms of complications include sudden pain, ringing in the ears, loss of the ability to hear, nausea, and dizziness. If a patient experiences any of these symptoms, the provider should immediately stop and examine the ear canal and tympanic membrane with an otoscope. If the tympanic membrane is ruptured, prescribe the patient oral antibiotics to treat otitis media prophylactically. Refer the patient to an otolaryngologist for specialty consult. Clinical significance. It is often necessary to perform ear irrigation for cerumen impaction if the patient is symptomatic or if the provider needs to evaluate the tympanic membrane. Cerumen impaction may cause a feeling of fullness in the ear pain or otalgia, itchy ear, the sensation of imbalance, cough, and of course decreasing hearing. Removing impacted cerumen often results in immediate relief of some or all of these symptoms should there not be any underlying infection, malignancy, or other pathology.